Welcome to Vital Times, the podcast series of the California Society of Anesthesiologists. I'm Dr. Ludwig Lin. In honor of December 3rd, International Day of Persons with Disabilities, this episode's topic is about differently abled anesthesiologists. My guest today, Dr. Rebecca Nause-Osthoff, is a pediatric anesthesiologist and clinical assistant professor at Michigan Medicine. She is significantly involved in the educational mission of the department throughout the life cycle of a trainee. And most notably, she is the director of medical student education. Dr. Nause-Osthoff is an ally and fierce advocate for equity. And through her work, she has mentored rising physicians such as Dr. O'Day. Dr. Leo O'Day is a CA2 at University of Michigan from Fargo, North Dakota. He attended the University of North Dakota for undergraduate studies and medical school. Currently resides in Ann Arbor, Michigan with his wife, Lindsay. Leo was born with a left upper limb deficiency. He is interested in cardiothoracic anesthesia once he finishes training, and also to continue to work within the realm of diversity and inclusivity within medicine. I really want to thank both of you for taking the time to be able to have this conversation with us and with our audience. I think we're all just going to learn so much about this. So I really appreciate it. Any disclosures you need to tell us before we proceed?
No, I have no disclosures.
I have no disclosures as well.
Okay. All right, let's get started because there's so much to cover. First, maybe I can just get one of you to tell us how you define disability when it comes to, or differently abled when it comes to a healthcare professional.
I mean, Leo, I'd be interested in your definition. I think the official definition according to the ADA is a mental or physical impairment that substantially limits one or more major life activities as compared to most people in the general population. And so that official definition, doesn't necessarily change when we're looking at different occupations. Certainly, aspects of accommodations within medicine can be unique to the medical field. But that general definition is going to be the same regardless of the occupation.
Yeah, I guess I've never really thought about the exact definition of it before. I kind of had to look it up when I heard that we were going to talk about it. So, but yeah, it sounds like that is the exact definition. I guess my own perspective is, it's something that limits you or doesn't. You know what I mean? And so you can kind of, it depends on the person probably and the scenario and their experiences more than anything on whether it's actual limitation. You know what I mean?
I was interested in posing that question to you too, because the way I process things, I suppose, I think, okay, so there are certain things like you said, Leo, that are perhaps limiting. Some of these factors might be limiting to such a extent that it does not align well with actually performing the job description of a particular specialty, for example. But then there are also legal implications, which I'm hoping that you will fill me in about the, the right of all Americans really to do something, to do a job, or to, just like have a life. So what is the boundary between what is, legally right? What are the limits of what somebody who's differently abled is able to do versus not do, and how that fulfills, for example, that particular medical specialty's job description. So could I get you to talk about that a little bit more for me?
Yeah, I think that Becca may be able to define like the exact roles and requirements needed in order to do anesthesia for specifically. She may be able to help with that more. But as far as the legal implications, I guess in my own experience, I only know like navigating my own residency application and going through residency and how you're not supposed to ask me about it necessarily unless I bring it up myself. There's not supposed to be any sort of discrimination because I have disability. And, I've been kind of talking recently about this with medical students and how it can, it's your own decision even to disclose some of this information, which I think, goes both ways, because I don't think you want to surprise people necessarily. But I also think it's a personal decision as well. And if you don't think that it's going to affect anything, I don't think you should have to say that as well.
Yeah, I think Leo has brought up some really important points, and certainly I'm not a lawyer, and so I would say that a lawyer is probably the number one best person to kind of clarify the exact legal implications. But I think when we're broadly thinking about people who have a disability, one aspect that Leo's mentioned is their decision to disclose that disability or not. And some disabilities are going to be apparent, so we may be able to see them and have a sense with what we see. And some disabilities are not going to be apparent. And in those instances, unless someone disclosed, we wouldn't necessarily have an idea. And that disclosure is the right of the person with the disability to make. And whether or not they make it is certainly going to depend a lot upon the psychological safety or the culture within which they're making that disclosure, but it could have really important benefits for their educational well-being or their professional well-being. And that kind of brings us right back to reasonable accommodations. And so when you think about reasonable accommodations within medicine, there are three kind of core tenets. So accommodations should not cause undue hardship, and that's usually being considered financially, honestly. And they should not fundamentally alter a curriculum or essential job functions. And they should not result in a threat to the health or safety of patients. And so while we're thinking about kind of those tenets of accommodations, it's important to acknowledge that this is where making sure you know the disability expert within your institution or enterprise could be really helpful, because there's going to be really different accommodations necessary for all sorts of different disabilities. It's not just like a one size fits all. And so understanding kind of generally accommodations, understanding who's your point person within your institution or enterprise to kind of get more granular with this for any specific individual, and then understanding that it's the individual's right to disclose, but if they do disclose, it could really help them, are kind of some important things I hope people learn.
And then
right.
I was just going to say, piggybacking off what Becca had said too, is someone may need accommodations. Maybe you've had a past resident, faculty, student, anyone with a specific accommodation for a disability. That accommodation may not work for the next person who has the same thing. And so it's really such a personal thing. I think it's hard to even define what they'll need without some input from that individual.
Got it. Let me betray my lack of experience and knowledge in this area by asking you another question about this. In terms of potential limitations, so, is there a certain point where certain limitations, physically speaking, are just going to make a particular specialty impossible for somebody to do? So let me give some examples. So for example, for me, one of the things I really just dislike about being an anesthesiologist is ducking down constantly to check the Foley, for example. You're bending down to pick this up, you're, doing this and that. So if somebody physically cannot do some of those tasks, does that rule out anesthesiology, or are those things that can have a workaround?
I mean, I think this is where it's key to have a clear a priori definition of like, what are your competencies or what are the essential job functions of an anesthesiologist? Because, reasonable accommodations, shouldn't result in a fundamental alteration of those things. And so knowing what those things are ahead of time is going to be really important for figuring out what might be a reasonable or unreasonable accommodation. And I think, as Leo's kind of already alluded to, like, it's really going to be important to have an interactive process that includes the individual with the disability, because I'm going to be quite frank, like, I would never have come up with some of the solutions that Leo has come up with and some of the innovations that Leo has come up with, because it's not my lived perspective. You know what I mean? Like, he is the expert on what is going to work for him. And so having that interactive process that includes the individual with the disability is, I think, really important. And knowing what are the essential functions of the job is also really important.
That makes so much sense. Leo, do you have anything to add about that?
Yeah, I think, and I speak from my personal experience, and maybe it was my own naivety at the time, but I actually, I didn't know the exact clear competencies for anesthesia. I just navigated my own realm of, I can do this. And I know that I am trying to advocate, that I was innovative enough to come up with different ways because I've been doing it my whole life. And that was my own decision to kind of navigate that territory when I was talking about it, because I thought, I think a lot of people think with disabilities, it's a negative thing as just like a context, whereas I think many times you have to kind of advocate that this is positive in these 10 other ways. And this is how I've learned to do these things and navigate it. And, again, I think it's dependent upon person to person, though, and being able to do or just advocate for yourself sometimes too,
Right. I respect that a lot. This seems like a really good time to ask both of you about your origin stories, how you got involved in what you have to be where we are today talking about this. I think with Leo, we've alluded to that Leo is differently able, and I want to hear a lot more about that. So I'd like to ask both of you that question, however.
Leo, you want to start?
We'll start with Becca.
Oh, you want to
start? Yeah. Go ahead.
So I would say that I was in general kind of primed for inclusivity in this area. My aunt actually recently passed away, but she was cognitively impaired from birth and lived with my mom for many years. And I would say that I saw firsthand growing up and into adulthood and in my profession kind of how significantly implicit bias about who she was or her abilities played a role in her life, and how poorly equipped people were in general to understand kind of who she was as an individual. So I would say that was kind of like a formative experience over the course of my life that maybe primed me for inclusivity in general. And as I became more involved in medical student education, particularly within the required rotation where all medical students take it, not just the electives where like the people who want to go into anesthesiology are taking it, I encountered more and more students with accommodations and realized that while at our institution and in UME, we have some unbelievable leaders and advocates at the University of Michigan, like Dr. Lisa Meeks is an international expert, and she is at our institution, that there were maybe some opportunities within anesthesiology to have kind of more conversations about the bias we might hold towards people with disability. And so I think seeing the students, seeing their resilience, seeing the unbelievable amount of hard work that they have to do advocating for themselves made me want to, help in any way that I could, be an ally, advocate for them, and help, bridge that gap, particularly within our field.
Yes. Sounds great. Thank you so much for doing that important work. Leo?
Yeah, so just a little bit of background on me. When I was born this way, I ended up going to the Shriners as a kid in Minneapolis, Minnesota. My parents, were really advocates for me to get in there because I think not every kid is kind of able to go into that, and so they really worked with me a lot, as well as various occupational therapists, physical therapists when I was a kid. And then my dad, even, he found that I thought it was really funny if I pinched his toe. So he would over exaggerate kind of when I was a kid. And that really made me cling to using a prosthetic because I started using it a lot. And then I think sometimes it's the way you're born too. I was, born into enjoying athletics and playing sports and that competitive nature. So I think it really made me better with my prosthetic by having to navigate that realm as well. And it really improved my dexterity, I think, with it and my abilities with it too. And then, just kind of fast forwarding into my career more so, I think I was always interested in medicine because of my background. And I ended up in anesthesia because of my want to do procedures, probably because of my sports background and wanting to use my hands and that nature. So I ended up in anesthesia, and I haven't regretted it since. Something that I've really how I ended up becoming involved in diversity and inclusivity was just because I think as a kid I was so strongly advocating I'm just normal, I'm normal, I'm normal. Like, I don't know. Don't ask me these questions because I'm good at these sports and whatever. You know what I mean? And I think, it kind of hit me when I was more of an early an adult that, maybe not everyone in my position can do the same things as me, or maybe I can help others, teach them to do these things. And I had, I had a strong experience where maybe when I was younger, because I was it was maybe a defense mechanism or what at the time, but someone had reached out to me because they got into an accident and saw I played baseball and wanted to know more about it. And I kind of brushed it off at the time and just, how maybe I was just younger. But then I met this person again when I was older, and, he told me it kind of hurt his feelings at the time, and it was a really powerful experience for me to be like, wow, I really need to take my own scenario and help others if I can. And so that's where I really first got interested. And then now through the University of Michigan and kind of being at a point in my residency, I've been able to kind of join in with some of the faculty and everyone to help kind of, share my story a little bit, and try to advocate for others and hopefully help other people with this, going into the future, and not have any reservations about their limitations on what they can and cannot do.
Thank you for sharing that. It's very inspirational and really powerful to think about how you can make a difference for others as well. It's it's like kind of speechless right now about all of it, but that's pretty cool stuff. I was trying to be prepared for this, and I had shared this briefly with Becca, and I'm embarrassed to say this is from Teen Vogue, but there was a interview that they did with a woman physician who, I'm not sure what her specialty is, but she has she had a stroke after a major operation, and she's got a lot of neurological deficits from it. And she was talking about the road that she's traveled to still be a physician and to practice and to be an advocate. And she said something in this interview that I just thought was really powerful and was a really good way to summarize and really parallels what you guys have said so far. So I just kind of wanted to read it as a way to reflect it for the audience as well. She said, "There's so much stigma and shame around doctors with disabilities that a lot of us are quiet about if we can be. And those of us who can't be quiet, we experienced a lot of questions about our fitness. Be unapologetic about what it is that you need, particularly around accommodations. We're so used to seeing accommodations as special treatment, but that's not what they are. It's just something to help you be able to do what it is you need to do." Her name is Diana Chehas, I think, Chehas. And I just thought that was a really beautifully worded statement that is also very empowering. And I want to share that with our audience. It's obviously not something that either of you need to feel. The next thing that I wanted to ask you about is, what are some of the myths about this area? What are some of the misconceptions that you just need to continue to dispel over and over about the way differently able physicians can fulfill their jobs as physicians? So, Leo, I think you definitely need to take this one.
I guess again, I think the disabilities definition is kind of funny in the sense that it's kind of like limiting someone, whereas that's again person to person. So I think maybe a myth is like you need. I always joke about with people to speak, to play poke at my own disability, when they say I need two hands to do this and stuff like that. I'm like, I don't know if you do need two hands to do this, I do that every day like this. And so I think, some of those myths of, I think, when you actually get into the nitty gritty anesthesia, there's so many moving parts and we're also multitasking regularly. And so, I think maybe a myth of that would be, having some limitation by not being able to physically, do the 5 tasks I need to at once efficiently. And so, like me having a prosthetic and my background, I can draw medications and I'm really good with my own dexterity in that regard and do it fast, or at least what I think is fast, I guess. But, I think some of the thoughts that come into people's minds that maybe that you alluded to earlier is like, oh, how would you do this specific procedure? I've only done it with my fingers. And I'm like, well, I'm pretty good at using all 5 of the fingers that I have, in probably 100% capacity. So I don't know if that's a myth or necessarily answers your question, but, some of the things, again, are, like I have said before, it's very person to person.
I mean,
Sounds good.
Like, I think Leo's point is like, or what I hear as Leo's point is like, just because you have a disability doesn't mean you can't be an anesthesiologist. And even if that disability impacts mobility in some way, that also doesn't mean that you can't be an anesthesiologist. That I don't know if you or like any of the listeners have heard of Len P Winnie, but he was this like father of regional anesthesia who got polio during training and was in an iron lung for a really long time and then rehabilitated. And this was like, a very long time ago. And he ultimately trained in Cook County, became an anesthesiologist, became like a founding father of regional anesthesia. And because he was a wheelchair user, he had all these amazing innovations where he like helped pioneer like a lateral neuraxial technique, or like cutting holes in the bed so that he could do procedures, or used a periscope at the time to be able to see what was going on. And I would just say that like that's another example of how sometimes we bring our bias to a setting, and in actuality, these people with disabilities can be physicians and can be anesthesiologists. And then I would just add another one, Leo, is that like for me, I think sometimes people feel like this doesn't really impact them. This doesn't impact their groups. And I feel like that is a myth. I think that just because people haven't disclosed disability widely doesn't necessarily mean that there isn't disability within your group. When you look at medical students, the rate of accommodations within US MD granting schools is going up. From 2016, it was like 2.7%. In 2019, it was 4.6%. So it's a relative increase of 69%. So the rate of accommodations is going up in medical students. As we get older, the rate of disability increases. And there are survey studies in the general public and then of physicians as well that kind of show that older physicians tend to have a higher rate of disability. And so I think that that's another myth out there, is that this just doesn't apply to us. This isn't something we need to learn about. And I don't think that's true.
And I really think too, just echoing off of that, it could be a physical disability. It could be someone, struggling with some sort of mental health too, that they don't want to disclose with anyone because they don't feel comfortable. They don't want their group to maybe perceive them differently, something like that. And so I think it goes along the lines of you never know what someone's going through personally, or even just, not all. We talked about this really at the SEA conference this year, is that not every disability is a physical disability. It's not apparent. You can't just subjectively see it too,
Yeah. And when you look at like those survey studies of medical students, the biggest increase has been in psychological and chronic health conditions for disability. And then when you look at like generally at physicians who are surveyed, I think there's around a 3% rate of self-identified disability in a study by Nawari and colleagues. And the largest percentage there was also chronic health conditions. So these are things that we're not necessarily going to see. And so this might be more relevant to us than we imagine.
It's very relevant because for me, just hearing about all of this and thinking about this, when we limit our pool of talent, whether it's because of somebody's skin color or socioeconomic background, or differently abled people, we are potentially losing talent. And why would we do that? We all bring different things to the table. So if we can't fulfill that job requirement, then it seems like it would be beneficial to have as many talented people as possible, rather than being so ready to pigeonhole people and go, well, you don't fit into this, neat little clique because you don't look right or you don't do every single thing physically that we do. So I think that's very applicable, and I think it's very thought-provoking. And it comes back to something I personally think about a lot, which is thinking about having enough empathy and considerateness to really be ready to include everyone and to welcome everyone. And we really just need to slow down a little bit and do that rather than being in a hurry to exclude. So completely agree with you. A slightly random question just to kind of, introduce some humor into this. What are your pet peeves about what happens?
I think it depends on my mood. Depends on the day sometimes. No, I think a really strong pet peeve that I have, I think, is just communication sometimes, and it's something that I think is always something that we can improve on throughout any specialty, is communicating amongst each other, between specialties, amongst providers, amongst patient, provider, just communication in general. Because sometimes it's something that's so easy that you can walk over to the patient, just ask them, and you have your answer right there. You know what I mean? But sometimes we have to go through all these loops to get to the right answer or something like that. So it's an ongoing battle.
And what is the way you usually try to deal with this?
As far as communication, I wish I could say I was perfect at it myself. You know what I mean? But I think I would, try to just at least, document as well as I can, for other people to understand my thought process. And then also, just closed loop communication within the OR is very useful too. Like when we're in cardiac rooms, we're like, lungs are down, lungs are back up, and everyone kind of understands what's going on from our end. And then, surgeons communicating back to us what they're doing as well. And then us reiterating that back to them. So those are a couple specific scenarios, but yeah. I'm still learning though, how to do it well too.
I think, I think communication is huge. I think that as a person who doesn't have a disability, I think that I have had to be willing to be really vulnerable at times and be really honest about some privilege that I've enjoyed that I never even really considered. And I think that that feels uncomfortable for us to kind of acknowledge that and acknowledge that maybe we're not doing as well as we could do. Maybe we're not using like the best, vocabulary as it relates to disability. I think all of those things are really difficult. And it's probably more than a pet peeve, but I think that like we all have to be willing to, be vulnerable and acknowledge that we're maybe not, there are areas that we're not doing well in so that we can get better and kind of move this along in terms of how inclusive we can be. If we ignore it, it's not going to get better.
Right.
I just thought of actually maybe another pet peeve I have, specific to anesthesia, but more to my prosthetic in this. So one of my pet peeves actually is when people want to ask me about my arm, but kind of tiptoe around the question. They'll be like, everyone likes to pause for about 2 to 3 seconds after they start talking about it. And they'll be like, so, and I already know what you're going to ask me. So you can ask me. I'm aware that I have a prosthetic arm, and so that's actually one of my pet peeves in that regard.
Yes, I could see that. Have you ever had really random questions directed because people are just, not aware enough? Like, I can imagine like infection control people getting involved. Have you ever had random things like that happen?
I haven't had any. I've had random questions. Don't get me wrong. But as far as like infection control, I think it's a topic that's an area that I don't know that most hospitals. I mean, I've only really worked in 2 hospitals, so the 2 hospitals, I think it's a topic that arrives when I'm about to go do something that requires sterility, and they're like, "What do you usually do?" Because they don't really know how to navigate that realm. You know what I mean? And so it
Mm-hmm.
might
Mm-hmm.
seem random, but it's a valid point. And so I've kind of come up with my own way of doing it, and it seems to be working efficiently. And I've never seen some sort of infection related to my care specifically that I'm aware of. And so I'm sure there will be someone, but I think that kind of applies to all providers at some point. Uh,
Right.
but I can get random questions like in my own personal life, not even in medicine. I get random questions very regularly about things you probably never even thought of before. It's hard to put a finger on it right now.
Right. If there's some awkward question, you've probably faced it. What along this vein, what are some really memorable, powerful moments that you've experienced? Both Leo and Becca.
I think the most powerful moment that I've actually had really, again, applies to me with my own disability and what that I'm doing in the operating room, because one of the surgical techs talked to me one day, and she said, I just wanted to tell you that my colleague saw you doing what you were doing and was too shy to tell you, but her son was born with a disability. I forget what it was, but she just was so like happy in what you were doing, just you being you, basically, in the sense that she gave her hope that her son could just have a normal life and do whatever he wanted to do. And that was really powerful for me in the sense that again, I maybe am not aware that just like some things that I have the ability to do or worked hard to get to can help other people by just being who I am. And so that was a really powerful experience for me because I guess she was like crying and stuff too. So it was really strong. It made me feel really good, even though I felt like I didn't really do anything specific. But it made me kind of continue to say, hey, like, I do a lot of different things other than medicine. Maybe if I just record myself, lifting weights, playing golf, playing video games, like stuff like that, and just put it on the internet, people will find it interesting or will show someone somewhere. So it kind of, made me motivated to start doing some of those things too.
You are totally right. That is a very powerful moment.
Yeah.
I'm sure you did so much for that kid. So
well, hopefully,
that's a good one.
He'll know that
yeah,
it's not really a limitation, right?
Right, exactly. Becca, I'm sure
I
you've had
can't
a
top
lot
that.
of moments.
I was like tearing up while Leo was telling
I
that
know, I know. Agreed.
I was almost crying in the operating room. I was like, oh my God, I expect that to happen right now.
I don't have any like moments that are as like amazing and it's inspirational as that. I think that for for me, most of my memorable moments professionally just come when I am able to, help a patient who's really struggling, in the perioperative space. And for me, a lot of this, in addition to just like, I think it's important for us to do this because it's the right thing to do, we also know that sometimes our care of patients with disabilities is not where it should be. And so, particularly like neurodiverse patients, I I think that when I've had opportunities to help move the needle in terms of their experience, that I hope kind of translates across their healthcare experiences. Those for me are really memorable and are kind of like not exactly related to this space, but kind of tangentially related for me.
It all ties in together. Yeah, along with that, along with, thinking about inspirational moments like the one that Leo was a part of, which is amazing. And back at all the work that you do constantly as a leader in education to help everybody, come up to a certain level of this. What are some of the goals that you have for yourselves in this profession and within healthcare down the road? Please share.
I guess for as far as goals, I think my immediate goals are to finish residency, and find a job that I am going to be happy at, and an environment that I think suits me, just like I did, for medical school and for residency. I think that plays an important impact on your personal life too, because I sometimes, what I tell people is I'm a doctor, how many hours out of the day, but I also have different titles, and responsibilities outside of that as well. So I want my outside life from medicine to correlate with my job, as well, and my career. And then I think going into the future, a goal I would have is to stay involved in this realm, and if I have more opportunities to help um, move this into the future and just continue to help people, that's what I would say would probably be a goal of mine as well. And hopefully down the line be able to teach some people or come up maybe with techniques that would help anyone, with anesthesia. So
Sounds good. Becca?
I think I just want to help continue this conversation within the field of anesthesiology, and help, Leo and others share their experiences because I think that, they're incredibly meaningful and really impactful and really can help us face maybe some of the ableism and like bias that we might have as physicians or anesthesiologists. And I guess my hope through those conversations are that, maybe we can move the needle on our care of patients with disability and, be more aware of that in the perioperative space. And, as we think about, kind of some of the elements about education and accommodations, those are things that require innovation and like for us to be individualized, and us getting good at that doesn't just help people with disabilities, it helps everyone. And I think that that is a really cool aspect to this conversation as well. But I think mostly my goal is just to, make sure people like Leo and others can share their experiences.
I can reiterate, people like Becca and like I've said Matt's name before. He's really helped me too. It's just like them starting these talks or even like having this presentation at SEA, it's really helped me be able to kind of step into the role that I would like to, just because they found interest in the topic, and it's given me a platform to help with them basically, and even express my own thoughts on the subject without, being a resident is so time consuming. It's not like I go home and I'm like, oh, I'm coming up with 10 ways to help do this while I can. It's kind of, they provided me with the resources just to even be able to share my experiences. And I really appreciate that,
Nice. It takes a village. And yeah, it sounds like at Michigan, you guys have started that. So that's really wonderful. I wanted to ask Leo one more follow-up question. You had mentioned that you started talking to some medical students about this and about potentially, for example, applying within anesthesiology. Can you share some of the advice that you've given to people?
Yeah. I think it's something that you don't really think about until you get there. At least I didn't. I think that's how I feel, throughout my life. I've been with my own disability is like, oh yeah, I remember maybe this isn't normal for everyone, and so some of the topics, is everyone tells you different things. Like, is it a good thing to disclose your disability? Is it a bad thing? Are they going to look differently on me, even though they can't, legally? Is this something that could be a strength? And I think that's, again, something you have to decide yourself. And so one of the things I advocated is my own reasoning for doing what I did. Whereas in my, cover letter applying to residency, I said that I have a left upper limb deficiency. And, this is a physical disability, but I think that because of it, it's made me who I am specifically, in the sense that, I may not be, the most book smart person, but I can tell you that I've come up with so many different ways that I can think critically, I think sometimes, or maybe outside of the box. Is kind of what at least I hope I'm doing, to come up with come up with ways to do things, or to come up with like maybe this obscure, hopefully like diagnosis someday or something, you know what I mean? And just, I think it's helped me like problem solve, which is a huge aspect of what we do. And so it's, I would advocate to most people who are navigating that, I don't think people can understand your own thoughts on something necessarily, because they don't have it. And so, using what you have is providing you with 10 other strengths down line, and maybe has changed your personality in some way, where I'm able to poke fun at my own arm because I like to do that, and stuff like that. And I like humor within my workplace too, a lot of times, because I think it helps everyone kind of feel more comfortable too, for example, so I think stuff like that has come from my own disability. So I think advocating that your strengths are your strengths because of it is really helpful too. I talked to someone specifically who had dyslexia, and she, was worried that it would be a negative thing. And I was like, the first thing I could think of in my mind is, I bet you learn things from listening 10 times better than I do, where I have to write things down because that's how I remember them, whereas you probably are able to just remember things, which I wish I could do from people talking to me, So I think like, just because you have that realm, you probably are a lot stronger at another way of learning though, so in kind of advocating that, because people aren't going to think about that unless you tell them too, I think, So that's kind of something that I've told the students, because it makes you who you are. And I think most programs, I think they're not looking for this cookie cutter type of person necessarily. They want an individual, and they want someone who's going to match well within their program, is going to be able to help others within their program. I think they want someone who's going to feels that they're going to be comfortable in their program as well. And you have to really decide that for yourself too. It's a match for a reason, it's, you get to choose them and they get to choose you. And so me personally, I was looking for a place that I thought like I would have fun doing what I was doing. I'd learn a lot, and I'd be a strong physician someday doing that. But that doesn't come with if I don't feel comfortable at that institution as well. And so that was a major reason why I chose to go to the University of Michigan, because I felt that way. So that's another aspect of it too.
Sounds like great advice. I feel like you should definitely be in this area. I like
I
it.
think most of my advice just comes from things that I guess I do though. I don't, you know what I mean? It's so like I've said probably 10 times so far, it's so person to person that, you know, your thoughts might be different than mine, and that's totally okay.
Right.
I think that
Well,
Leo, oh, sorry, I was just gonna say, I think Leo highlights
yeah,
a really important point too, which is just that, like, as you know, that's really good advice for learners, like for med students and residents with a disability. And I think that educators and leaders within anesthesiology also need to understand that there are things they can do that make disclosure easier, um, you know, both like psychologically, but also like logistically to figure out how to disclose a disability. And I think that we should just be a little bit more proactive about making a plan instead of waiting until, you know, it's immediately necessary. I think those are things that we could do to help our future colleagues a lot.
I think a really cool experience that I've had too, just to reiterate off of the faculty, is that, you know, I've had it now where a lot of times, you know, I was initially coming up with a way to bag mask because all the machines are designed to use the bag on your right side. And for me to do that with my prosthetic would be really awkward to reach across my body to do it while I'm bag masking. And so I was coming up with, you know, extending the bag to put it between my legs, like stuff like that. And one of the faculty, I forget who, just said, why don't you just use the machine and put it on like a pressure controlled ventilator and just have the machine do the work for you, like if you were by yourself completely. And I was like, oh, I never thought of that. And so now that's how I do it most of the time. There's usually so many people in there that I don't have to worry about it, and I can tell people to help me how I need to. But it's funny now down line because so many faculty that see me do that are like, that is really smart. Like, that's really cool that you came up with that. And I'm like, that wasn't me, but I appreciate it. Thank you.
that is really smart. I love it.
It was smart from that person that told me.
Yeah. Well, I feel like it's time for us to start wrapping this up. But what I always want to do is make sure that we got the most out of our guests. So I want to make sure that I ask each of you, um, are there things that we haven't covered that you absolutely want our audience to come away from this conversation with?
Leo?
I think we covered a lot of really good topics through our conversation today. You know, I can't really think of anything specific because, you know, I think I guess one thing that I did think of is that again at that our conference that we spoke at, I think a lot of program directors are kind of experiencing unique various people or individuals with disabilities. And I think using your colleagues, using that person specifically, and providing them again with that environment just to feel comfortable to come up with ways to maybe combat a problem is going to be a strong thing moving forward for that person too. And so I would say like it kind of goes both ways. You know, if you're on the faculty at maybe a residency or just within a group, or if you're a resident or a student, you know, just I think it's okay to lean on other people to kind of navigate that topic as well. And I would hope that you feel comfortable doing that, which maybe we've talked about, but I just maybe wanted to reiterate that again.
That's beautiful. We should rely on each other.
Mm-hmm.
Maybe we need to do it more. Yeah. Becca?
I think that, you know, the two things that I hope that people come away from this podcast with are, you know, we've already touched on. One is to make a plan. You're going to be so behind if you wait to just respond to a situation when it arises. And if you make a plan, I think it's just better for everyone. And then the other thing is just to really be honest and think about, you know, what your implicit biases might be. There was a study in 2020, and over 80% of healthcare professionals implicitly preferred people without disability when they were asked questions in that regard. And I think that we need to be honest about this so that we can, start to combat those ableist and biased thoughts.
Agreed. Thank you both for those really thought-provoking insights. I think I personally learned tons from this conversation, and I'm hoping that our listeners did as well. I'm so grateful that we had the opportunity to do this. And I think it's perfect to be thinking about this in anticipation of December 3rd, the International Day for Persons with Disabilities. And for me, it's been a very educational window into this particular space. However, there are some universal truths which you've alluded to, both of you, which is we need to lean on each other. Leo just said that. We need to accept that we all have differences, and some of those are actually huge pluses, advantages that we can bring, and we need to remember that, and everybody needs to remember that, and that perhaps, being ready to accommodate for individuals, whatever those individual characteristics are, would be useful. And also to generalize that to our patients, because it always comes down to patient care, and to create that generosity to other patients as well. So I really love this. Thank you both. And hopefully we'll get a chance to talk more. And I really look forward to seeing the work that you both will continue to do in this area. So this is going to conclude another episode of Vital Times, the California Society of Anesthesiologists podcast. Please like this, subscribe it. It's around the internet. All right, y'all take care.